Welcome everybody in. It's your host, DM Livingston, the Waterbury-This Sunday Special Report. Rethinking Mental Health Response in Connecticut. This year, Connecticut has been shaken by two separate police-involved shootings in Hartford, each involving a person in crisis who was later reported to be experiencing a mental health emergency. The deaths of Everard Walker and Stevie Jones, both described by family members as struggling psychologically when officers arrived, as reported in the New Haven Register, have reignited urgent questions about how we respond to mental health crises. In the most recent incident on February the 27th, Hartford police were called to Blue Hills Avenue after a family member reported that 55-year-old Stephen Jones was harming himself and armed with a knife. Officers attempted to de-escalate and a taser was deployed but was ineffective. When Jones continued moving towards officers, one fired 9 shots, striking him. Jones died days later at the hospital, and the state chief medical examiner ruled the death a homicide. Less than 2 weeks earlier, another Hartford man, 53-year-old Everard Walker, was also shot and killed by police during what his family said was a mental health crisis after officers responded to a wellness check requested by a mental health center. These back-to-back tragedies have sparked protests and calls for change in Hartford and across Connecticut, with community members demanding accountability, transparency, and a reevaluation of how emergency responses are structured. As someone diagnosed with bipolar 1 disorder who has publicly shared his own experience with the mental health system, I know how critical it is for individuals in crisis to receive compassionate, expert care, not a lethal confrontation. And when families call for help, they should feel confident that the response will protect life, not end it. What are we doing now and why it's not working? Right now, police are the default responders to almost all 911 calls involving a mental health crisis, even when no obvious criminal behavior is at the core of the situation. Training varies widely, and often officers arrive with guns drawn long before mental health professionals can even be called to the scene. Hartford's police department does not require all officers to carry non-lethal tools like tasers, unlike many other Connecticut cities. And while officers may attempt de-escalation, the lack of specialized crisis response units means that people in the midst of psychological distress are too often treated as law enforcement problems instead of healthcare situations. A Veronica protocol for Connecticut? In the Marvel universe, the Veronica protocol exists to contain Bruce Banner when he becomes the Hulk, not to hurt, but to help keep everyone safe while trained professionals, the Avengers, can step in. That model of containment before confrontation has striking parallels to what many experts now suggest we need here in Connecticut. A specialized crisis response team trained specifically in mental health de-escalation, negotiation, and nonviolent containment that can be dispatched instead of or alongside police, especially when there is no overt criminal threat. This kind of team doesn't sound soft. It sounds strategic. It prioritizes life and safety for both the person in crisis and the first responders who currently face the impossible choice between arresting a suffering neighbor or escalating to deadly force. 2 deaths in a matter of weeks, both far too close to home, too familiar for families statewide. Labeling these incidents extreme doesn't capture their human weight. It normalizes a system that fails the people it's meant to protect. We can and must do better. Connecticut should lead on creating a model that moves beyond guns and fear towards safety, calm, and medical first responses where appropriate. Not tomorrow, not next year, but now. This has been your host, DM Livingston, the Waterbury-This Sunday Special Report. And as always, peace, peace.